everything you wanted or needed to know about heart health. We're joined by someone I know very well, Dr. Brett Sealove, who is the Chief of Cardiology at Jersey Shore University Medical Center. Good to see you, my friend.
Pleasure is all mine. Thanks, Steve.
Let me disclose that Dr. Sealove has been a student of mine for several years in the Hackensack Meridian Health Physician Leadership Academy. I've been teaching leadership and communication there. I've gotten to know him. And I've also called him when he hasn't wanted me to about other questions about heart health. But let me ask you something. Biggest misconception about heart health, particularly as it relates to men and women. It's a male, it's a guy's thing. It's not an issue for women, you say.
I say that's 100% true. It's been an old man disease when I was in training. And as it turns out, that is a complete fallacy. More women die from heart disease than men statistically. And this, it is the #1 killer in the world, men and women. So it is a complete fallacy. We need to change the face of heart disease for sure.
So let's get at this. Again, I've asked you a lot about, I disclose this all the time, that my father had heart issues. My grandfather I never knew died well before I was born from a heart attack. He was 44. So every time I'm getting a little ache and pain, which I have this morning, I freak out. What is it? I go to my cardiologist. Then I call Brett offline. My point is this. How much is it genetics? And how much is it because if we eat right, exercise, don't smoke, don't drink a lot? Which is which here?
Yeah, I mean, broad strokes, just for your viewers.
It's not about my health, it's about everybody else's.
I think most experts would argue that heart disease is up to 80% preventable. Now that number is staggering when you think about the medications that you take to minimize your risk. There is nothing that will mitigate your risk for heart disease other than a healthy lifestyle. So again, all comers, about 80% of it is preventable.
So let's be more specific. Smoking is a problem with heart health.
You got it. It's one of the most preventable causes of heart disease, and we can mitigate.
What is the connection between being overweight/obese and heart health?
A tremendous link, and that link is typically due to insulin resistance, diabetes, and those things come with other bad behaviors, unfortunately, inactivity, high blood pressure. So it's this cascade of events that typically we see when people are obese or have obesity.
So let me ask you, are the issues the same for men and women? I know I keep going back to men and women as it relates to A, what they can do in terms of lifestyle, and B, treatment.
Yeah, I would tell you that men and women should go about this the same way. It is about prevention. We are very good at treating your heart attack when it happens. We're not perfect. About 12% of people die from a heart attack when it happens, but we're very good if it's treated early. But the real answer is prevention. You have one engine in life, and that's sitting in your left side of your chest, and we better treat that really, really well, man or woman. The problem with women, again, historically, they've been negated from clinical trials and textbooks, and they present with non-classic symptoms. So that's problem #1, is they get actually their first EKG when they enter an emergency department across the United States is minutes later than a man. So first of it, it's recognition. Women present with non-classic symptoms, jaw pain, back pain, severe indigestion, just sweatiness, and not the classic elephant on my chest, down my left arm, and shorter breath.
So men, I told you I had a little bit of soreness over here, and it probably is from working out or having a cold, and again, not always, and we're not diagnosing or putting this out on the air as the end and be all. Usually with men, it's the left side.
Usually with men and women, it's the left side. But again, it is the #1 killer in the world. So you're dealing with an incredibly common disease. And unfortunately, that presents more often in an uncommon fashion. So my answer to this is always, I was never taught what classic chest pain should be, because there is no what it should be. If your body is saying something to yourself, this doesn't feel right, you should seek medical attention. There are classic signs of stroke and heart attack.
I'm sorry for interrupting. What about down the arm? If it's down the arm, that doesn't always happen. That's correct. And that's why we really don't teach this in training, and we don't really tell patients. It only is with chest pain in the center of your chest, down your left arm. It's if something doesn't feel right and you've never had it before,
I would argue that you should let somebody know, a loved one and then a physician, probably in that order.
COVID and heart health. Talk
Yeah.
about it.
Yeah, well, there are two things I would answer. First and foremost, unfortunately, COVID has affected obviously us all, but it's affected heart disease as well. People are presenting much later with their heart disease, much later with their stroke, much later with their heart attack. And when it comes to heart and brain, time is everything. So we see a lot of bad results for heart attack and stroke. So that's thing number one. Thing number two is there are implications if you succumb to COVID, that there are complications to the heart. So it's really a double whammy.
And the connection between vascular issues and heart health.
Well, vascular issues and heart health in the context of COVID has to do with inflammation and blood clotting problems. Vascular disease and cardiac disease are linked because it's cardiovascular medicine. We're dealing with a very similar process of hardening of the arteries across the continuum of your body.
Say it again, 80%, I keep looking at this number, 80% of heart disease cases preventable.
Yeah. I mean, that's the guesstimate across the population. Now, I tell people that if it's 50% in patient A versus patient B, let's just use statistics to what they are. They're a guesstimate. We want to walk into the game of life from one decade to the next as maximized as we could get you. And a vast majority of it is lifestyle.
Real quick before I let you go, people who have had significant heart procedures, surgical, and the surgery's changed dramatically. To what degree have you seen people come back to live pretty healthy, dare I use the term, normal lives?
Yeah, heart disease is not a death sentence. It doesn't have to be, and it shouldn't be. So if you have heart disease, you could live till 120, God bless your soul. It doesn't mean that something is terribly tragic about to happen. But when you have heart disease, it increases your risk for having more heart disease. And with aggressive medical therapy and close surveillance and lifestyle, you can live a long, fruitful life for sure.
Dr. Brett Sealove, I cannot thank you enough for joining us. Chief of Cardiology at Jersey Shore Medical Center, tied to HMH, Hackensack Meridian Health, a longtime supporter of what we were doing in public broadcasting. Brett, I want to thank you so much for joining us. We appreciate it.
Pleasure's mine. Thanks, Steve.
I'm Steve Adubato. That's Dr. Sealove. We'll see you next time.
Think Tank with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by the New Jersey Education Association, New Jersey Sharing Network, NJ Best, New Jersey's 529 College Savings Plan, Wells Fargo, the Russell Berrie Foundation, the Adler Aphasia Center, Georgian Court University, Johnson & Johnson, and by Summit Health. Promotional support provided by Insider NJ, and by the New Jersey Business and Industry Association.
Hi, I'm Joe Roth. In New Jersey, there are nearly 4,000 residents in need of a life-saving organ transplant, and one person dies every 3 days waiting for this gift of life. One organ and tissue donor can save 8 lives and enhance the lives of over 75 people. You have the power to make a difference and give hope. For information or to become an organ and tissue donor, visit www.njsharingnetwork.org and be sure to talk with your family and friends about this life-saving decision.